It is July 31st, 2014 on Thursday. It's 10:02 a.m. Pacific time. And up next, everybody, I put up something on the Ebola virus last night. This is something else that I thought would interest you. This is by Dave Hodges of the Common Sense Show. It's dated July 30, 2014. He gets all the credit for this piece. The U.S. is quietly establishing Ebola quarantine centers. Most border crossings in Liberia, located in West Africa, have been closed, and communities hit by an Ebola outbreak face quarantine to try to halt the spread of the virus. The symptoms include high fever, bleeding, and central nervous system damage. Fatality rates can reach 90%, and the incubation period is 2 to 21 days. There is no vaccine or cure. How it all begins. United States aid worker Nancy Wright-Bull, a missionary sent by the Calvary Church in North Carolina, became the second American citizen to contract Ebola. Previously, Dr. Kent Brantley, a doctor also working at an Ebola clinic in the capital of Liberia, Monrovia, had previously been infected with the deadly Ebola virus while treating victims of the disease at a hospital in West Africa. Ebola is transmitted through bodily fluids, stated Tariq Jazarevic, a spokesman for the WHO, who said around 100 health workers had been infected by Ebola in 3 countries. The virus has now killed 660 people across Guinea, Liberia, and Sierra Leone since the outbreak began nearly 6 months ago. Ebola has a mortality of approximately 90% and overwhelms the healthcare systems of the communities in which it appears. Containment. The past week has seen Ebola infecting key medical staff in Sierra Leone, a deadly Middle East virus become airborne, and a whole city in China put on lockdown for fear of bubonic plague. Lockdown? What exactly is lockdown? If a community is to stop Ebola, they must go into lockdown procedures. Lockdown procedures include the closing of the border to a present non-infected nation. The map below shows the impacted countries experiencing an Ebola outbreak. Let's take a look. Quite a few areas there. More intense color shows multiple outbreaks. Why are we admitting people to the U.S. who are coming from a region with a live Ebola outbreak? Presently, Ebola is not being tested for at the U.S. border. Both Dr. Jane Orient, one of Arizona's top physicians, as well as other researchers such as myself, have received information from Border Patrol informants that as many as 100,000 West Africans are being admitted to the U.S. under the same provisions that President O is presently admitting so-called unaccompanied minors. These people are from the same region of the world as the uncontained outbreak of Ebola. As Dr. Orient said in her interview on the Common Sense Show on June 30, 2014, it is not a matter of if Ebola comes into the U.S., but when. The United States containment procedures. Fortunately, the U.S. has detailed procedures to deal with a pandemic outbreak, and it carries the force of law. And under Section 361 of the Public Health Service Act, 42 U.S. Code 264, the U.S. Secretary of Health and Human Services is authorized to take measures to prevent the entry and spread of communicable diseases from foreign countries into the U.S. and between states. The authority for carrying out these functions on a daily basis has been delegated to the Centers for Disease Control and Prevention, the CDC. The CDC utilizes 2 basic strategies when trying to contain a public outbreak of something as deadly as Ebola, and they are isolation and quarantine. Isolation is used to separate ill persons who have a communicable disease from those who are healthy. Isolation restricts the movement of ill persons to help stop the spread of certain diseases. For example, hospitals use isolation for patients with infectious tuberculosis. Quarantine is used to separate and restrict the movement of well persons who may have been exposed to a communicable disease to see if they become ill. These people may have been exposed to a disease and do not know it, or they may have the disease but do not show symptoms. Quarantine can also help limit the spread of communicable disease. Quarantine involves the creation of detainment facilities in which people who are suspected or are infected with a pathogen are forcibly detained and not allowed to leave. Boy, that sure sounds like a FEMA camp to me. This statute also applies in the same manner as people who may be exposed. The United States, is moving to establish quarantine centers. Even if there was not a present immigration crisis at the border, there is a significant outbreak of Ebola in a 7-country region of West Africa. With modern air travel, this government should be enacting protocols to limit the chances for Ebola from coming into the United States. But instead, President Obama is having ICE and DHS load up the buses and planes at taxpayers' expense, ship them throughout the U.S. without going through a minimum of a 3-week health screening period. In other words, Ebola's incubation period. This is highly irresponsible and could be considered to be an act of treason being committed against the people of the United States. Under federally mandated quarantine procedures, here is what the CDC and President Obama are mandated to do in the present crisis. Here is what is supposed to happen as described by the CDC. Okay, and you can read all about it. I'm going to skip over that for now in the interest of time. Instead, we are getting this type of Obama-led method of pandemic protection as described below. Okay. And I went over that part of it by Paul Watson, I believe, the other day. If not, then you can read up on this. I'm going to skip over it because there's a lot here. All right. So, conclusion is the following. At a time when city, state, and federal budgets are stretched to infinity, we are supposed to believe that out of the goodness of their hearts, LA County is going to provide these kinds of services at this kind of expense to previously ignored homeless people. Remember that story I just put up on the channel regarding LA County and the FEMA camps? Does any of this make any sense given the economic state of the country? Paul Watson is calling these facilities FEMA camps. I agree with Paul and would also add that they are FEMA quarantine camps. This is the early preparation for what's coming. Cities across the country from Tempe, Arizona to Charleston, South Carolina are outlawing homeless people as it gives the government to quarantine these people. A clear pattern is emerging that we are soon going to see from California to South Carolina homeless people being quarantined, held against their will, for health reasons. The handling of the present and potential Ebola crisis speaks for itself. When there is trouble, America, who are you going to call? 30 years ago, we called the Ghostbusters. In other words, hit movie 1984, which is a whole lot better than what is available now. And Dave Hodges is the editor and host of the Common Sense Show. This was delivered by the Daily Sheeple. Who are we going to call? And who's going to call who? Well, you can't call the Ghostbusters in this case. Okay, so FEMA camps. Let's look at this for just a second before I close the video out. Now they're suggesting that it's going to turn into a quarantine camp for health reasons. Not because they're poor and homeless necessarily. I have a feeling this is going to be because, well, they're going to cause the Ebola virus or other viruses to affect people and make them sick, and that's going to give them a reason to stick people into FEMA camps, which they're going to politely call them quarantine camps, quarantine facilities for your own protection. Duh. What does that tell you, everyone? And I'm not saying this is what's going to happen. I'm just putting that out for info. And I already know how everybody feels about Alex Jones and Paul Watson and et cetera, et cetera. I already know that, everybody. And I am not spreading disinformation. I have never spread disinformation. I've been on YouTube too long, and I respect people too much and care about folks too much to do something like that. My sole purpose is to provide information that you can use, that you can do more research on your own. This is not representative of my own personal viewpoint, and I don't have any way of verifying or confirming that the information is exactly what's going to happen. It's totally up to each individual. All right? Always. That's going to do it for now, but it sure makes you think. You know, when you look at the other video I just put up, and you look at this video, and you look at the LA FEMA camp video, and you look at all those issues that are going on right now, economic collapse, chaos out of order, you know, order out of chaos, whichever way you want to look at that, and what they're setting us up for. The first thing that came to my mind when I was thinking about all this, I'm thinking billions and billions of bullets, hollow point bullets. I'm thinking millions of coffins. I'm thinking, you know, the borders are open, wide open, with big holes in them, and all these people are coming over. Nobody's doing anything about it. Gives you a lot to think about, but we better think fast, because the situation is going in one direction here, and I can see where it's going. Can you?